So this is a video to show you how to update the settings for your Engage Arrive screen. This is presuming that the Engage Arrive screen has already been set up and paired in the console. So this is just showing you how to access those settings, update waiting rooms, etc. So first of all, you need to navigate to the management console. You can either do this by visiting the Engage client, which should be downloaded onto your PC, or visiting lt.engage.gp in a web browser, and it will then bring up to log in to the Engage client. And then once you've logged in, you'll be able to select Management Console. It will take you straight to appointment arrivals, as you can see at the top here. And this is where you can go in and update your settings for your screen. So first of all, we've got our general settings. So we've got our arrival windows. You can go in and update at any time the number of minutes early patients can arrive and also the number of minutes late. You can also select if you want it to check patient contact details. So basically what would happen is it would ask the patient if their details are correct and it would show them on the screen. If they are not, they can go and visit reception and get those updated, or if they're missing any information as well, you can go to reception to get those updated. So it will inform the patient on the screen. Anytime you update settings, just remember to click Save, and that will then push through to the screen. Waiting areas, you can add a waiting area and have as many as you need for your practice. So you can name the waiting area and also add in an instruction to display to the patient. Under consulting staff, you can update the consulting staff list. It will update this drop-down menu here. You can select the staff member you want to update the waiting area allocation for, and you can either select a waiting area for them, which would always be correct, or if they actually move about and you need to set different waiting areas for each day, you can choose to set different waiting areas and select which day and time periods you want to use it for and where you want it to direct those particular patients to. If you are a customer that have questionnaires enabled, under the questionnaires section, you'll be able to select a questionnaire which will be able to display on the screen to the patient. This will be a QR code that they scan and then fill the questionnaire in via their mobile, and you can choose if you want that response to not be reviewed and just sent straight to the clinical record. If you do not select that option, it will come in as a request in the Engage client for you to review first, and then it can be sent to the clinical. Again, remember to click Save on any of these settings you update. When I click on appointment arrivals, you'll see I've also got the option for mobile. So if it's not already, you can enable mobile check-in so patients can check in on their mobile phone and not have to use the screen. You can also display an information message like you can on the screen, and you can select how far they have to be from the practice before they can check in. You can also select an appointment location, so if you have multi-branch site, to make sure they have arrived at the correct site. So they're the main settings for the touchscreen. Obviously you have got your touchscreens here as well that should already be set up. If you ever need to go in and change anything, you can. So you've got your shared settings, so you can change the question that's asked as they check in. So are they asked for their day of birth, month of birth and surname, or day of birth, month of birth and year of birth. And that will update it for any touchscreens you have in the practice with Engage. If you actually select one of your touchscreens and you needed to repair it for any reason, you can. So you can just pop in your touchscreen code. You can also enter that location as well, again for those multi-branch sites to make sure arrivals can only happen for appointments at that location. You can update your information message at any time. Once you click Save, it will update that on the screen for you. And you can enable HealthPod input. So once you enable HealthPod input, you can select what you want to enable, so whether that's blood pressure, weight and height. And that will allow the patient, as they check in, to enter their blood pressure, weight or height, and that will go straight on their clinical record coded. You also have the ability to enable friends and family test following an appointment, so that can be sent out and you can choose how that's sent as well.